Hi everyone, I'm Dr. Annette Mercatante from the Clair County Health Department. Welcome to our Facebook Live session. We do this every Thursday to answer your questions and concerns related to COVID. And my special guest today is Mark White. Mark, you want to introduce yourself?
Hi everyone, Mark White. I am the Deputy Director for the Clair County Office of Homeland Security and Emergency Management. This has been my career for the past 7 years. Came in as a planner. Was promoted last year to the Deputy Director spot last June. Prior to that, I served 32 years with the City of Port Huron, starting off as a police cadet to dispatch to fire department, and eventually retired in 2012 as the fire chief. So I bring a wealth of experience to our office and have a lot of fun doing it.
Much admired first responder, so thank you for your service.
Yep, a lot of fun.
Yep. So let's get to the questions. First of all, we always start out with our data. There's been a lot of questions and concerns about our data. Let's start out with what we have today, and then we'll talk about some of the changes that we've made and why we've made them. So we have the data up here. This might look familiar to you. It's in the same format as what we were putting out earlier. This data has some new aspects to it. The same numbers, what we call aggregate numbers or cumulative numbers across the top. So these are the totals from the onset of our cases in mid-March. And then on the bottom in those green bubbles, we have some changes which I think are much more important than the day-to-day numbers. As I've described to you before, day-to-day numbers can vary a great deal based on the situations of staffing and how we're investigated and when things go in and out of the system. But daily averages over a week's time give you a much clearer perspective on what's going on. So in the green bubbles, we see that over the last 7 days, we have had 5 new cases. That means we have had less than 1 case per day in the last week. I believe that's one of our lowest rates ever. So then our third bubble is that we've had an average number of tests per day of 137. Again, that varies up and down, but the average amount of testing daily is 137. And at this time, 2.8% of the tests that we have done this week have been positive. Now you'll see another number if you go to the dashboard, and that is the percent positive numbers in the tests that we've done all along, and that's at 6.5%, correct? Under 7%. So again, these numbers, you have to be careful and look and see how we're measuring them, but we're going to try and get back or moved towards weekly averages so that you can see where we're going from week to week. And again, the reason we want you to focus on weekly averages as opposed to day-to-day numbers is because those day-to-day numbers can vary a great deal based on circumstances and not because there is more or less disease in the community. And remember, what you're looking at these numbers for is to decide whether or not you are having greater or less risk by going out, right? That's what we're all doing. So something that came up briefly earlier in the week, I think we had a sudden increase in 17 active cases, and that's because in our investigations in a nursing home where actually I think 17 residents had been removed from the active case list because they had recovered, they were feeling better. We are now going in and testing repeatedly, and 17 of those residents, I might be misspeaking the actual number, but a number of those residents, after their nasopharyngeal swab was done, still had positive testing. They were clinically better, they were feeling better, but we are obligated with a positive test to put them back in an active category. So these little nuances are going to mess things up on your numbers thing, but from a perspective of what you need to be concerned about are those weekly averages. On the bottom, in the blue boxes, it might be hard for you to see, but these are important parameters. We call them demographics. The percentage of positive based on age and on sex. And we have about 43% males, 57% females. Throughout the nation, we're seeing about that 50-50 split. Males and females do not seem to be any more or less at risk. But if you notice, most of our positive cases are in the 50 to 69-year-old range. And the next most positive is from our 30 to 49-year-old range. And I want you to pay attention to the fact that those are our highest percentage positives when we get to a couple slides from now where we talk about what the ages are of the people we've been managed to test. So let's go to the next slide. This is an important slide for you guys to watch. This is the average number of cases in our county over time. So it's the average number of new cases per day, but calculated over a week. So that if we have one of those situations that I just described at the nursing home, where we suddenly have to put a bunch of cases back in, even though they're really not, probably not really sick or contagious, then those numbers get balanced out over time as averaging. So this is a much more reliable way of looking at things. And as you can see, there's two graphs, one with long-term care facilities and one without. They're both very similar. We have a very low rate of new cases at this time, and we've been in that direction now for some time. So this is the graph to watch, okay? This is the graph to watch. And we're going to be putting these out weekly because it's a weekly average. However, we might go ahead and put it out twice a week so you have a chance to see it, and hopefully that will help you kind of understand risk throughout the week. You don't have to wait for a Friday or whatever day. Next slide. Boy, we need to use different colored bars because I don't know how easy this is to see, but this is our testing per week, average daily testing per week, along with our positives. And you can, well, we've shown this before, and this is the positives coming down. This graph is positive testing for all the testing we've done since we started. And I mentioned before, we're going to be reporting as well the amount of positive testing in just the last week, so that we can see a little bit easier, a little bit quicker if that change in positive rates goes up. And then our last slide. And this is the one I was referring to you. This is these bars represent the percentage of testing that has been done in each age group. And these are the same ages that I showed earlier as far as percent positives, and I mentioned the biggest positives were the 30 to 49 and 50 to 69, and you can see that we test a fair amount, but we test way more of our 70 and older. And that's because we're doing a lot of testing in nursing homes. So in my mind, I look at this and I say our testing needs to focus a great deal more on our younger citizens and our younger residents. We want to see more of that middle-age group coming through and getting tested so that we can pick up those positives a little quicker. Is there any more slides after that? Oh, and so with the discussion of COVID, health equity, and the social determinants of health, we know that race, income, and education have profound impacts on people's health, and COVID in particular has been shown now across the country to disproportionately affect our African American and our minority populations. And what you can see here is the fact that we are tracking this, and we have seen about a 4.6% of all of our cases being in the African American community. And overall, according to the 2010 census, our African American community represents about 2.5% of the population. Now that would suggest that we have more cases in our black community, which would certainly go along with what we're seeing nationally as well as the state. So we're going to watch this very closely. But again, I have to caution you, with low numbers like this, it can easily be skewed. So we're going to continue to watch this carefully. And these are the kinds of things I think that are really important to focus on. So the first question was, why did we remove the daily updates from our Facebook page and our social media? And the bottom line is, daily updates aren't really very helpful. You might think they're helpful and they may be very important to you, and you're in luck because you can still find them on our dashboard, which I think I was on the first slide. On the first slide, but it's our dashboard at scchealth.co. It's very easy to click the link. It's 2 clicks, and you can find every single daily number update that we have been giving you all along. In fact, it's in a very similar format. You will also be able to see, however, these important graphs. So the bottom line is we've switched because, number one, it's a lot of resources committed to something that doesn't have a lot of value added, and we want to get all of you guys to start focusing on trends and information that's going to help you make better decisions and not worry so much about those small day-to-day variations. rest assured, I promise you, we are still watching very carefully. We are looking at these numbers every day. We are investigating every case, Monday through Friday, and if things pick up, we'll be back to 7 days a week. So just because we're not posting it in the ways we have, the information is still there for you, and rest assured, we are still on it, and the surveillance is still very active. Yes, last slide. That's one more area. This is a new website that has been put out by the state, and it's MiStartMap.info/. If you have an opportunity, please go to the site and take a look. There's a lot of, you can drill this information down to the county level as well. Even though we're in Region 1, the Detroit region, you can click on our county and get absolutely, now, their data is represented per million cases. The state has done that as a standard approach. They calculate their numbers per million. We have not been doing that. We are calculating our numbers in a standard way based on just our population. And so when you look at numbers compared to our numbers, we're measuring the same things: new cases, testing, positive testing. It's kind of the same thing we're looking at. The state's website, this MiStartMap, the numbers will look different, but because they're in per million. Okay, so be aware of that. But look at the trends. Look at whether we're at a high or medium or a low risk area. Most of the numbers are showing us in a low risk, and that will give you the same reassurance and the same information as what we're giving you. Okay? Hopefully that helps, and we'll keep doing this until there's no more COVID left to talk about someday. Mark, you have a question? Why don't we go to you, and you can answer one of the questions that's given you, and then we'll get to the Facebook questions.
All right. So first question we have: how does the EOC communicate real-time health updates about the coronavirus pandemic to the public? Great question. So obviously we use social media to get the message out, usually through our Be Ready Facebook page in conjunction with the health department's page. We like to correlate, information together. So
well, let's face it, the information you share is the information we have.
So that it correlates. So there's a reason behind that logic. But we're very much in the know that we want to make sure the public is fully aware of what we're doing. We like to be transparent. What comes into our office doesn't stay there. We get it out to everyone as best as possible. The Facebook Live interviews are another great way to, just a tool to get information out to our folks in the community. The weekly now data reports, which obviously there's a little bit of controversy, but once again, it's still a fabulous tool to see where we're at in the county. As Doc mentioned, the daily updates have been kind of repetitive. It's showing, not a whole lot of...
Repetitive and confusing.
Yes, so it hasn't shown a lot of...
And so I think our goal is to not confuse you, but to give you useful information.
Absolutely. So we want to be useful. And then, of course, the data dashboard. That is really kind of huge. And then press updates as well. I know Director Justin Westmiller is always on the phone, teleconference with the Times-Herald and various news agencies around the area. So we're always... making sure that everyone stays informed to the best of our knowledge.
I have to say, working with the EOC has been a pleasure and also an eye-opening, because there's big differences in the way the EOC operates, which has really always been kind of driven by first responders and, responding to big incidents with fire and police. And public health works in kind of a different bubble. We work with epidemiology and science, and so we work in different ways. And I have to say, it's synergistic. It's been very complementary, but very different. So, how you guys react and respond, hopefully, is complementary to the way we're doing. So, if you don't like the way we're doing it, check out the EOC's reports, and maybe you'll like them better. But we are using the same information. In fact, we learned quickly that we need to use the same information pulled at the same time.
Absolutely.
Because that was a problem at the beginning. You were pulling your information at 4, and we were pulling ours at 10, and guess what? It was different, right? So, anyways.
It has been a good learning experience for us all, and from all these years in public service, seeing this side of the health department, it's been a learning curve for us as well too. So I know Justin and I have
Most people do not know what we do. Yes.
Absolutely. So it's been a great learning curve and a good
Sure.
experience so far.
Jennifer,
So.
do you have some questions?
Yes, we have 2 questions so far. Can you also mention that people are welcome to type in their questions?
Yeah, you are welcome to type in your questions.
Okay.
Please do. And if we don't get to them today, we'll get to them for sure.
Oh yeah.
Thank you.
Mhm.
Okay, the first question. Speak on the need for continued diligence and the need for wearing masks.
Oh, that's the question or the comment was please speak on the need for ongoing use of masks. It could not be more important than it is now. We only have, again, a couple of tools available to us to prevent the widespread transmission of this virus again, and that is social distancing, which as you've gone out and see, we're seeing less of the people are anxious to go back to the stores, etc. Masks are the second thing. And actually there's quite a bit more information in the literature, in the research that really indicates that the use of masks, consistent use of masks, is really the deal breaker when it comes to communities that are able to maintain a low level of transmission versus those that see big spikes. This does make a difference. And so please, if you're going anywhere where you might be within 6 feet of another human being that doesn't live with you, please put it on. Please put it on. It does make a difference. And it makes other people more likely to go out and enjoy those things as well.
Okay. Next question. What is your opinion of using a shield rather than a mask?
The question about a face shield versus a mask, and that's really, there's no science or research to tell you one way or the other. But general opinion and expert opinion would suggest that a face shield is better than nothing. So if you can't wear a mask, putting a face shield on will at least eliminate your respiratory droplets from going further than they might otherwise. It's not going to prevent the air coming around, but quite honestly, neither does this. So yeah, I would say a face shield better than nothing. Absolutely.
Okay. Mark, do you want to take your next question?
My next question, okay, so who can I ask in the future if I have a question about COVID-19 safety protocols at work, home, school, etc.? Another good question, and with that, we still have our COVID-19 hotline that is still in play at 810-966-4163. That is still being monitored, I believe, 8 to 4 each day, 4:30 each day.
Or send an email through
And
the code.
email at situation@stclaircounty.org, and that's STCLAIR county.org.
You can also do COVID-19.
Big, simple one, COVID-19 at stclaircounty.org.
Yep. So there's multiple venues for people to get in contact with us, and that's part of that EOC monitoring staff here that we're always checking those sites for any new inquiries, new questions, comments, or whatever. You know, that's part of our purview.
Yeah.
Just checking
and it's
all
helpful. We banter them around. If we get one that's more of an EOC area, if they get one related to health, we get it to the right person. And I can tell you, we, as far as I'm concerned, have strived to answer every single question we've received. So don't hesitate to write or call.
Speaking of questions, 2 more have come up.
2 more questions.
All right. Next question. In regards to the nursing home cases you
Yes.
mentioned before
Right,
that were retested and found to be positive,
right.
what was the time frame between the time they were initially tested and retested? Was it 14 days? The person.
So the question was, what's the time frame when these people, these positive cases, were removed from active, put into a recovered case, and then the entire nursing home residency population was tested again, and some of these people that had been removed from the active cases were still positive. I would have to look at each one of those situations individually in our system, but I can tell you it was at least 14 days, because if they were removed, they were not removed because of 2 consecutive negative tests, which is one way to remove somebody as being active. You can do it 2 ways. You can do it based on clinical recovery and 10 days from the last day of fever or symptom onset and symptoms resolved, or 2 consecutive negative tests 24 hours apart. And that 2 consecutive negative tests 24-hour apart. It's not really being used across the board. It's just very labor intensive. It's being used for residents returning to nursing homes by the hospitals, by most hospitals. So to get readmitted to the nursing home, you need that negative testing strategy. But if you're already there and you never left, chances are these people were tested once, were removed a week or two later, or became sick, were tested, and were removed when they got better, and then when we went back, I can tell you that this round of testing was the third round of testing that we had done in this facility. So it was at least 3 weeks after. So that is a problem we have. We do know that the virus stays in some people's nostrils and respiratory system a long time. We don't know why. We don't know whether that means they're infectious or not. It may mean that the virus, the dead virus, is still lingering and laying around, but we don't have enough science and information to really say that for sure, so we err on the side of caution and call them an active case still.
Okay, next question. This person has a dentist appointment next week.
Mm-hmm.
They think they read once that there were no instances of COVID-19 transmission in dental offices. Is there any the latest research or anything done on that?
So the question is whether there's been any reports of COVID transmission because of a professional dental visit, and I might just add because of a professional medical visit. And as far as I know, I have not seen anything in the literature that would suggest that. Now, it's possible with the million and some cases we've had that's possible out there. But I can tell you this, your healthcare professionals have taken this very seriously. And for the most part, they are taking extreme precautions in their offices to protect themselves. If you notice, they're wearing full PPE. Dentists have always worn full PPE from I don't know how long. So their risk of giving you COVID is so low. Your risk of getting COVID from somebody who is fully protected with PPE and has taken it seriously is very low. Your risk of getting COVID instead at a crowded bar that you're sitting at for a couple hours where no one is masked is much higher. So just keep that risk in perspective. I personally would feel very comfortable going to my dentist or my doctor's office at this point in time.
Mark, do you want to take the next question?
All right, so next question is, so as of today, the Emergency Operations Center has been activated for 98 days. That's quite a stretch of over 3 months we've been at this. And so we're going from a fully activated state to a partial activated, and people are wondering, okay, what does that mean, and what are we doing since it's a partial activation. So being a partial, that we're not so much actively monitoring, but we're still engaged. We're almost at a point where we're looking at, okay, do we see the end of the tunnel for COVID, and how do we get back to what's going to be perceived as the new normal? And with that becomes a lot of committees, a lot of task force groups coming together of different varieties and looking at, okay, how do we move forward? How do we move on? And some examples, we've got a business recovery work group sponsored by our Economic Development Authority, looking at bringing all of the community partners together. Okay, how do we re-engage the public? We've got a St. Clair County Recovery and Reopening Task Force. That brings a lot of our community leaders together, and they're talking about issues and how do we move forward with operations. We have an Education Reopening Committee, not only locally, but it's a huge presence at the state. I know the State Education Board
Next
is really...
big hurdle.
That's a big hurdle, looking at how do we reopen schools and all the process in place to keep the students, the staff, and parents, and everybody safe. So we're looking forward to the things coming out of that committee. We've also got our pandemic response team, which is looking at any type of mental health issues that might affect our community, whether it be the first responders, it could be the public, it could be anybody. This committee of highly trained people is going out and talking to groups and finding out issues and problems and how do we work through that, and what can we do to help people
overcome this trauma.
It's a different type of trauma, but it's
not the kind of trauma you get from an accident, but it's been long and drawn out.
Absolutely. So it causes just a lot of different stressors to the body. So it's been a good process there. Plus the fact we still do virtual monitoring, especially on the weekends, even though we're Monday through Friday. I know Justin and I still tie into our computers and looking at what's
Yeah.
going on.
We do too.
And we also, our office ties in with the state Emergency Operations Center. Every 2 weeks there's a webinar for all the emergency managers across the state. And we all get on the same board talking about issues and problems and what is the next big thing. We talk about financial updates with the state, look at response, we look at logistics, all the PPE supplies, how are they coming through, what are our shortfalls, and what can we do better. So it's the constant evolving process, and it hasn't let up yet. So.
Never a dull moment. Do you have another question for us? We have a few more minutes left.
Nope, but 5 minutes left. Do you have another question?
Yeah, 5 minutes left. I have one more question that came in. It was about a recent study that was published June 18th, actually, probably just came out in the New England Journal of Medicine. And it was a study that was done that was able to link severe outcomes of COVID-19 with blood types, specifically a very specific genetic component of blood types. And this reinforced a similar study that came out of China. So this didn't prove anything, but it does suggest that there may be a link between the people who get very severely sick on mechanical ventilation, etc., and those who do not. In general, the study suggested that people with type A blood are prone to get more ill, and people with type O blood tend to be able to stay healthier. Remember, type A is the most common blood type we have, and type O is the most rare blood type we have. So this doesn't mean if you have one blood type or another, you don't have to worry. More to come. It's just one of those things that's very interesting and makes us all wonder, what next? Is that it?
Yeah. I don't know if you want to just make a comment. As people are watching the news and such, they're seeing other states that are having an increase in cases and such.
Oh, please, yes. So I will make that comment. So even though Michigan, yay, Michigan is one of the states that continues to see a lowering rate of cases, continuing movement. The governor's talking about reopening to phase 5 by 4th of July. If you look in the news, we see now 22 states have increasing cases. This isn't over, and this does not mean we're exempt. We need to be careful. We need to be using our masks. We need to be watching our numbers. And more than anything, we need to be communicative and cooperative. So when we suddenly say, hey, people, we're seeing a little trend forward, people are willing to back off. I think the future really depends on all of you. We're here doing our job. We're not going to stop doing it. But what you do, is going to be the compelling factor on how things go over the next months to maybe a year. So.
One last question came in, then we can do closing remarks.
All right.
What do you do if a salon says whatever you're comfortable with is their protocol? They will wear a mask if you ask. You can wait in the salon without a mask.
What would I do? So the question is, what do you do if you go to a salon, and let's just say any business, and they say, well, you can wear a mask if you want, or you don't want to wear a mask. You know what I would do? I would say, not only do I want you to wear a mask, I'll want to wear a mask too. I want to be honest with you. My partner has had cardiac disease, and we don't go to places that are not following the rules. It's too much of a risk, and we're just not comfortable. So I think if more people stood up and did this and said, no, I'm more comfortable if you wear a mask, and they're willing to do it, it becomes a little easier over time. This is just new and difficult. So speak up and say, yes, I would in fact be more comfortable if you wear a mask. And if they refuse to wear a mask, take your business somewhere else.
Okay, time is it? Sorry, it's 3:59. How about closing comments?
Why don't you do? I've been talking a lot. Mark, you have anything to say?
So just rest assured that your officials at St. Clair County are doing their utmost to make sure our communities stay safe. We're in touch with our law enforcement group, our firefighters, our EMTs. We're making sure that we have the pulse of where they're at and their needs, and also time with our hospitals. So we really tie into a lot of our community folks, and especially our first responders, our healthcare workers. We care deeply about them as much as we care deeply about the residents of St. Clair County, and it's all the conjunction. So we're all in this together. We've got to get through this together. So that's my closing comment.
Hang in there.
And any last minute questions, they can call the hotline.
Yeah, any last minute, and we'll be back next Thursday. Do we have a special guest next Thursday?
Waiting for confirmation on that.
Okay, but we'll try and bring you more special guests, and please keep your questions coming in. The more you ask, the more we know what's concerning you and the kinds of things we need to respond to. Have a great day.
Stay safe.
Mhm.